It's Dr. Rhonda Johnson. Today is Thursday, December 1st, 2022. Now, my message today is about the vaccinations and dying from COVID. There was an article published in the Washington Post on November 23rd that I think is worth noting. The title read that COVID is no longer mainly a pandemic of the unvaccinated, and here's why. Well, to cut to the chase, they noted that in August of this year, 58% of COVID deaths were in vaccinated people. Now, this was from a report that the Kaiser Family Foundation released to the Washington Post. Now, a senior representative from the Kaiser Family Foundation said in this article that there were probably some contributing factors to this. The fact that, one, the majority of adults in the United States are vaccinated with at least the primary series, so more deaths are going to start occurring in vaccinated people. Now, also, people who are 65 and up are at the greatest risk of dying from COVID-19, and new Omicron variants, such as BA.5, which dominated in August, are better at resisting the vaccines. And current COVID vaccines lose their effectiveness over time, and people need to choose to get boosters to continue to be protected. Now, that was the article. That's what they suggested were contributing factors. I have a few more of my own. Now, this is my opinion going forward. We're seeing a relaxation of prevention behavior, such as wearing masks, even among people at the highest risk. Two, we don't know how many of these folks who died in August had recurrent COVID infections. We know from the work coming out of the St. Louis VA health system that reinfections carry a greater risk of dying. Also, we know that those original COVID vaccines were specific to the original strain. Omicron has ushered in a entirely new pandemic, and the first Omicron specific booster was not rolled out until September, which means that people who died of COVID in August might have only had weak protection from their prior vaccines. So what's the bottom line message that I want to convey here? I have a message for people who have been vaccinated. If you're vaccinated and boosted with the original vaccine and the original boosters, you may not have adequate immunity, especially if you are 65 years and up. You know, only 13% of U.S. adults so far have gotten this bivalent shot that targets the BA.5 Omicron variant. And we know that some of these circulating BQ variants are ancestors of BA.5, so this new booster shot should help shore up your immune system should you encounter the virus. So talk to your doctor, talk to your family, talk to whoever you need to talk to, but you may want to get that booster shot, especially if you have a lot of socializing planned for over the holidays. Another key takeaway message is that getting vaccinated and boosted is not enough, and this is my opinion. You need a multi-layered approach, which includes awareness of your health risk, especially if you're 65 and up, management of ventilation where you are, getting those windows open, getting that fresh air, wearing a well-fitted mask when you're in crowded indoor settings or using public transportation. Maintain that good hand hygiene. Try to stay away from people who are sick and coughing and sneezing because we don't know what they might have. And use the rapid test. You know, if you're elderly, you can ask people to test before they come and visit you. And use of Paxlovid if you test positive and have no medical contraindications. So that's my message today. I hope that it's helpful to someone out there. Please be safe and take care.